I always think for allergies, a multi-pronged approach is usually the most effective. If you're allergic to dust, which, cleaning your house back, like if you have carpets in the home, vacuuming the carpets frequently or changing the carpets out for something like hardwood or something that traps dust less often, washing your sheets, trying to avoid being outside at certain times of the year or at certain times when the air allergen load is very high. Wearing things like a filter or a mask can be really helpful. And sort of simple things like that can make a huge difference.
Hello, this is Anthony Effinger. I'm the host of the Think Neuro podcast at Pacific Neuroscience Institute. And today I'm talking with Dr. Michael Yong. He's an otolaryngologist. That's one of my favorite words. And we're welcoming him to the show to talk about something that will be familiar to everyone. Dr. Yong, how are you?
I'm great. Thanks for having me on the show, Anthony.
So tell us a little bit about you. Give us your background. Where are you from, and where'd you go to school, and so forth, and then we'll get into the topic.
Yeah, of course. I'm actually Canadian. I grew up in a smaller city called Winnipeg, sort of just north of Minnesota would be the kind of equivalent in the United States. And then I did most of my medical training and residency up in Vancouver, west coast of Canada, sort of similar to how California is the west coast of the United States. And then I did a little bit of graduate studies in Baltimore at Johns Hopkins, and then I did a clinical fellowship at Stanford University, and eventually I made my way down here to Southern California to work in Santa Monica with Pacific Neuroscience. So I'm super happy to be a part of the practice going forward.
Now, tell everybody what an otolaryngologist does.
Yeah, it's a little bit of a mouthful. The colloquial term for it is an ENT, or an ear, nose, throat doctor, which may be more familiar to a lot of people. Basically, we see a lot of conditions that relate to the head and neck. I basically say that, everything above the collarbones is sort of stuff that we deal with, minus maybe the eyes and the brain. But a lot of those other things, issues with your ears, issues with your smell or your breathing, through your nose, your mouth, your throat, your neck. We see a lot of that stuff. But, within the specialty of otolaryngology, or ENT, there are a lot of different subspecialties too. This particular subspecialty that I focus my practice in is nasal and sinus issues, also known as rhinology.
Okay. Now, PNI it has a pretty large otolaryngology practice. Why is that?
Yeah, good question. Pacific Neuroscience Institute, our practice, originally started as a sort of neuroscience focused area of specialty, but we sort of grew into this field where there are a lot of related specialties to neuroscience, cognitive health, and brain health. And that involves all of the senses that we use to interact with our environment. So our sense of smell, our sense of taste, our sense of hearing, our ability to breathe. And a lot of patients who have neurosurgical procedures or who have cognitive issues, need optimization of all of those things. And so our practice kind of has grown organically to involve a lot of different specialties that touch on those different areas. So we don't just have neurosurgeons or neurologists. We have, interventional neurologists. We have speech language pathology. We have, throat doctors or otolaryngology. We have all of these different specialties, endocrinology, interventional radiology, all these things that kind of help support this mission of improving people's brain health, improving cognitive health, and improving, quality of life in general, so that people are able to age healthily and to live a higher quality of life.
Tell us how you got interested in ENT.
Again, like I said, ENT is a little bit of an interesting specialty because we cover so many different areas. And one of the major things for me was that in otolaryngology, there's not a lot of other not a lot of other doctors who understand really what we do. If you look at cardiology has cardiac surgery and sort of the split between medical and surgical issues. Neurosurgery has neurology, but there's no medical or surgical equivalent to ENT. We basically deal with the whole spectrum of what we see, both the medical side and the surgical side. So, we operate a very kind of special niche, I would say, that kind of is pretty cool, because you get to be the really expert at everything that, is dedicated to your realm, your field, your anatomic site, really. The other thing is that otolaryngology has a very colorful history in terms of how it's evolved. It evolved from having to use the headlamp and small magnifying glasses to be able to see into small orifices, your nose, your mouth, your ears. But we've developed a lot of technology in terms of light technology, endoscopic technology, to be able to look into small areas such as your nose, your mouth, your ears, in a minimally invasive fashion, and really be able to build a specialty around, being able to do surgery interventions in a minimally invasive way that really improve your quality of life without, having to do an invasive surgery sometimes. There are a lot of toys and technology that we use in the specialty that make it a lot of fun and interesting.
A lot of toys and technology. What's the split for you between surgery and other kinds of care?
I would say for me, roughly, maybe about 60-40, 70-30.
Mostly surgery?
Mostly medical, mostly being in
Medical.
clinic, seeing patients in the hospital. And then probably about 40-30% of the time I'm in the operating room.
So let's talk about the sort of the main event here, the main topic today, which is allergies, which is something I think a lot of people can relate to, especially this time of year. I, for one, know something about that. Um, Tell us what brings allergy sufferers to you.
Like I said before, my area of specialty is mostly focuses in the nose and the sinuses. So I end up seeing a lot of patients who have nasal manifestations of their allergies. So, blocked nose, inability to breathe very well, runny or drippy nose. And then sometimes, allergy overlaps with sinus issues. So, can contribute to worsening of people's sinus health, sinus infections.
Hmm.
There's facial congestion or facial pressure, that sort of thing.
Okay. We should probably talk about the mechanics of allergies. Why, what, I mean, this is going to sound basic, but what is an allergy and why does it manifest in the nose like this?
There is a complex kind of mechanistic explanation behind allergies, but we'll limit our discussion to allergies as it applies to really the respiratory tract, the upper respiratory tract, the nose and the sinuses, and that really most of that discussion is focused around what we call aeroallergens. So things inside the air that produce an allergic response. So these are things like pollen, dust, that are floating around the air that you inhale that land on the lining of your nose or your sinuses, and then as an extension, sort of your throat and your lower respiratory tract inside your lungs, and produce an allergic response, which is part of the kind of immune inflammatory cascade. The sort of the long story short is that the lining in the nose and the lining in your respiratory tract react in a certain way when they sample these things in the air and interpret these things as more dangerous or more aggressive than they really are. So your body will mount basically a response to these things in the air and react in a way that is inflammatory. So it'll produce mucus. It'll produce edema or inflammation or swelling inside the lining of these different parts of the respiratory tract, and also lead to different things like itchiness or watery eyes. Again, runny nose, blockage and breathing of the nose, that sort of thing.
Okay. What is it about pollen? What is the magic of pollen and that our bodies overreact to? Is there something about that as opposed to dust?
Well, yeah. So all of these things are aeroallergens, and actually, a lot of people are equivalently allergic to things like pollen, grass, trees, dust. Dust is more of what we call a perennial allergy, which is kind of there all year round, and some of those other things that we think of, trees, grass, ragweed, those are more of seasonal allergies. But all of these things, for some reason or another, as we've evolved, I think it's some of these things that used to be helpful for us in the past are a little I wouldn't say harmful, but kind of more of an annoyance now that we're not hunting in the wild now. We're living in sort of housed environments and things like that. But now things like dust and aeroallergens are a little bit more of an issue for us.
What should people do? I mean, I should ask this personally, but what is this? If you are suffering like run of the mill kind of garden variety allergies, what do you do? What's the best thing to do?
I always think for allergies, um, a multi-pronged approach is usually the most effective. So starting with all the way at the bottom of the ladder, sort of allergen avoidance. So, if you're allergic to dust, which usually is also a dust mite allergy or a type of dust mite allergy, um, cleaning your house back, like if you have carpets in the home, vacuuming the carpets frequently or changing the carpets out for something like hardwood or something that traps dust less often, washing your sheets,
Mm.
doing all that kind of stuff. If you're outside and you have seasonal allergies, trying to avoid being outside at certain times of the year or at certain times when the aeroallergen load is very high. Wearing things like a filter or a mask can be really helpful. And sort of simple things like that can make a huge difference. But for a lot of people, that's not enough. And so that's where I usually see people is, hey doctor, my allergy symptoms are pretty bad. I can't really breathe through my nose. I'm
Mm.
really running. I also have itchy nose and itchy eyes. What can I do? Simple things that are really helpful are to starting with some sort of cleansing agent in the nose. And what I often recommend is either a saline or saltwater rinse or spray inside the nose that can really help to, first of all, clear allergens or irritants out of the nose. Especially if you're working outside or you're spending a lot of time outside, that load of irritants inside the lining of the nose can build up, and so rinsing that out and cleaning that out can be really helpful. The other thing that salt water does is it is somewhat of an osmotic agent, so it helps to reduce some of that tissue edema or swelling inside the nose, which can be really helpful. And then the other things that I often recommend that are available over the counter but are also available prescription are something like a simple steroid nasal spray. You can find these at the pharmacy or at Costco or at any other drugstore. Flonase, Nasonex, Rhinocort. They go by a lot of different names,
Yeah.
but nasal steroid sprays that act to really dampen that immune or inflammatory cascade so that it's not so vigorous or so intense. The other thing that can be really helpful is an antihistamine. A lot of people know oral antihistamines, things like Allegra, Claritin. Those can be really helpful, but I also find that people with nasal manifestations of allergies really find that an intranasal antihistamine can be helpful. And not a lot of people know about that so much as the oral antihistamines. The one that I commonly use is azolastine. Several different companies make that antihistamine, but it's also a spray. And the benefit of the sprays inside the nose, as opposed to oral medications, is that they're associated with a lot less side effects because they don't have to be distributed entirely in your body systemically. They really just are sprayed directly into the nose. They act directly where the problem is, and they don't really have a whole lot in terms of systemic side effects.
Yeah, okay. That's helpful. So those medications, I mean, because sometimes it feels like they don't work, but they do.
So there is also an important distinction between these medications and something like a nasal decongestant that people may use on an off and on basis because of particularly nasal breathing issues. Now, the one thing I'll say about nasal decongestions is that they can be somewhat dangerous because and these are things like Afrin at the pharmacy is a popular one that you may know of. Um,
Hmm.
these really shouldn't be used on a regular basis, past like 2 or 3 days in a row, because they can cause rebound nasal congestion. And I've seen several patients that are hooked on Afrin, and it's really difficult to try to get them off of it because it can cause the opposite thing of what you're seeking. The medications that I use, the intranasal corticosteroids or the antihistamines, these are actually meant to be used on a more long-term basis because that's how they work best, is by dampening that immune or inflammatory response over the long term.
So two offbeat treatments to ask you about. You ever heard of a neti pot?
Yeah, good question.
Okay.
So most people know what I was talking about, either saltwater or saline rinse or spray by the name of the neti pot. So neti pot really actually is a low volume, low pressure way to rinse out the nose. What I find is actually a little bit more helpful is actually using a higher volume irrigation. So
Mm.
the one that I usually recommend to patients is a simple squeeze bottle, and there are multiple companies that make sinus or nasal irrigations, but essentially it's just water, and we encourage people to use either the distilled or boiled water that's cooled, and then add in a salt solution, which you can get over the counter at the pharmacy. They make prepackaged salt solutions that you can add, and they're really easy to do. You shake it up and then you rinse it inside the nose. You can also make it at home with a balanced salt solution recipe that you can find online. Some people just find that's a little bit more tedious, but I do find that that higher volume, higher pressure irrigation inside the nose really helps to actually move irritants out of the area and to rinse a little bit deeper into the nose and the sinuses, which can be really more helpful. And some people also may find that some of the fancier versions, some of the powered irrigation tools in the nose. I don't know if you've seen these products. One of them that I know that's popular is called the Navage, and I don't have any connection to any of these companies that make these devices, but some people really find that these motorized electronic ways of irrigating the nose are really helpful.
Interesting. So the neti pot is legit, and these other higher pressure systems are simple. Some of them very simple are better.
Yeah, usually actually those are the ones that I recommend.
Yeah. Okay. Interesting. Yeah, my wife's a big fan of the neti pot, and I'm like, are you sure this is you're supposed to do this? And I'll take it from you that's fine.
No, it can be healthy and something that a lot of people use routinely.
Okay, but maybe not with just straight up tap water, because
don't use straight up tap water, because it's important to use a solution that is what we call isotonic or balanced in terms of the electrolyte composition, so that it doesn't cause an irritation. Like you may have experienced before, if you swim in a swimming pool, or you're swimming in a lake, if you get water up your nose, it causes a stinging reaction. That isn't so much of an issue if you actually swim in the ocean, because the ocean is salt water. So it's important to be able to use a solution that has the right amount of salt content that makes it so that it doesn't cause an irritation reaction.
Oh, so it's not that tap water is somehow not clean. It's something else.
Yeah, I mean it that's why we advise using either distilled or boiled water. There are some microbes inside tap water, but that's not really the reason why you feel irritated when you use it. It's because it's not balanced with the salt.
How interesting. Okay, great. All right, here's the other thing. I once heard about somebody who had and I think I read this in the New York Times sometime. I read about a guy who had such terrible allergies that he began, I think, what did he do? He ate like raw chicken or something to try to get a gut microbe to give his body something to fight so that it wouldn't inflame. Because the theory was that our immune systems are looking for something to do. And if they don't have enough to do, they're like the dog that tears up the living room, right? When you leave it alone, they'll go after these things that are actually not a threat. Have you heard about this sort of thing?
I haven't heard about that specific article. I think there are a lot of theories out there surrounding that. I would say that based on our evidence and the research that we have, I don't think I wouldn't make any recommendations to go ahead and eat raw chicken or raw food routinely. I do like sushi actually, but that's another issue. I think that the body is pretty robust, and it is able to mount responses to a lot of different things all at once, and multitask and do all these kinds of things. So, I think that if there was a magic bullet to make allergies better and all that stuff, I think that someone who came up with that would be making a lot of money right now.
Yeah, but, I figured. I just had to ask because I was very struck by that strategy, and it's not one I would pursue myself. So I want to ask, like, how bad does it get? Like, I mean, you're a surgeon. You're highly trained in this area. You must see some very difficult cases. How bad does it get for people with nasal allergies?
So I'll give you two cases. First of all, allergy. When I see patients with nasal and sinus issues, allergy can be the sole issue that's going on in terms of, people just have symptoms, from dust and they're perennial. They're associated with obstruction in breathing, runny nose, itchy eyes, itchy nose, or they can be seasonal. But it's just to do with their allergies, really. And then there are this group of people who may have allergies, but also have more of an inflammatory issue with chronic inflammation inside the nasal cavity and sinuses, which we really call chronic rhinosinusitis. So that's a little bit of a different issue, but it does overlap somewhat with allergy. And it does get a little bit complex because some of those mechanistic processes behind why we have these things overlap. And so those are two different cases, but I'll talk
Hmm.
about an example from each of them. Actually, from the allergy perspective, my dad has pretty severe allergies, and so when his allergies flare up, and he's not the best kind of patient either, but when his allergies, he says, he's outside and he'll say, my allergies are so bad, I'm sneezing. I just need to go home and sleep. I need to sleep for the next 4 hours. I'm done. So and that's not gonna kill him. But when we're out doing activities and he's out doing something, that actually limits his quality of life pretty severely. If you have to say, I made a plan to go out and do something, I'm gonna stop doing that because I need to go to bed and go back home now. That to me is something that's like, hey, I don't think this is being controlled adequately. It's
Hmm.
actually affecting your quality of life and limiting what you're doing from a day-to-day perspective. And we do know that from epidemiologic and public health research on diseases like allergies that are pretty common, but that are pretty debilitating actually when you look
Yeah.
at a population level. In that if we're having people that are not able to do their daily activities or the things that they were intending to do, or they're missing work, or they're missing school, or they're being at work or school but not operating at 100% capacity, that's a problem because that refers to absenteeism and presenteeism, and that results in a lot of quality of life loss, but also a lot of economic productivity
Hmm.
loss too. So that's on the spectrum of allergy. Now, when we talk about patients with both allergy and possible chronic rhinosinusitis, that's a little bit more of an involved issue that I deal with on a regular basis. These people have other symptoms than just allergy. They'll have recurrent facial pressure or pain. They'll have loss of
Hmm.
sense of smell, and then they'll have sinus infections that happen. They may have nasal polyps that manifest inside the nasal and sinus cavity, which is a little bit more of a different discussion than today. But suffice to say, that requires a little bit more of an in-depth management, both medically and surgically. That allergy has a role in that because it has somewhat of an overlap with some of these other inflammatory conditions that are going on. It's important for us to think about how to manage all those things together and at the same time.
Okay. Yeah, I had a friend who had both allergies and nasal polyps, and he was miserable. He basically, couldn't breathe, and he had a procedure to kind of open things up in there, which was, it was a little grueling. Because it's sensitive stuff, right? I mean, it's right there. But he's much better now, and yeah, he wouldn't have had it any other way. So you mentioned two cases. You mentioned your dad. Was there another one?
Yeah, so the second case is a little bit more nebulous, but yeah, the second case is really I see a lot of patients with chronic rhinosinusitis that also have allergy manifestations. They commonly do, and so for those patients, I'll be putting them on a little bit of a step up of their medication regimen, but also often end up talking to those people who have very severe refractory symptoms about what a potential procedure or surgery could do for them in terms of long lasting quality of life benefit.
What's the surgery?
Yeah. So, for people with chronic sinusitis and allergies, they often need, who don't have symptoms that respond to medications, by the way, which includes sometimes oral medications, but more often, regular use of topical medications, like we say, like rinses and sprays in the nose. Now, just having an aside for just a second, the reason why we would step up to something like a procedure is because if you think about the anatomy of the nose, when you think about the nasal cavity, the part that you breathe with to get air into the lungs, that's sort of more or less a tube that goes from the front of your nose to the back of your nose and down to your lungs. And so if there's issues with allergies or inflammation in the nose, getting a rinse or a spray inside the nose is relatively effective, and that's why a lot of people with allergies, can manage pretty well on that kind of thing. But people with chronic sinusitis or very severe allergies that results in a lot of inflammation inside the nose, your sinuses actually live in different parts of your face, behind your cheeks, above your eyes, between the eyes, and at the back, sort of in the center of the skull. Now, even if you rinse or you spray medications inside the nose, if you have a lot of inflammation, you just can't really get into those areas where the inflammation has blocked off the entrances to the sinuses. And like I was saying before, the rinse and the sprays are really good because they can deposit medication exactly where it's needed. But if it can't get to where it needs to go, it's not really that effective. Now, the alternative to getting medications to those areas, i.e., steroids, antihistamines, that sort of thing, to try to reduce that inflammatory burden, really is limited to then oral medications that try to use the back door to get to where they need to go. But of course, those are associated with a lot of systemic side effects. So if you're using systemic antibiotics, that's not super healthy for your gut. There's a chance for you to build resistant microorganisms in your body. If you're using systemic oral steroids, which a lot of people who have really severe sinusitis need to use to really whack out a sinus infection or an exacerbation, or when their symptoms get really bad, when they get a cold or an infection, that has side effects too. We know that people who take courses of oral steroids eventually have greater risks of developing weakening of their bones, osteoporosis, higher incidence of diabetes, heart disease, that sort of thing. So long story short is that, when people have really refractory symptoms with sinusitis and allergies, and they're having to use a lot of oral medications, we think of, how can we optimize this? And surgery is one of those ways that we can reduce the inflammatory burden by removing polyps, removing inflammatory tissue, opening up those sinuses and helping the sinuses drain mucus out, but also achieving a state in the sinuses where things are more open, so that now we can get rinses and medications that are sprayed or rinsed inside the nose into those problem areas, so that, long term, that's a more viable way of controlling the inflammation. And the last thing I'll say is that, things like allergy, things like chronic rhinosinusitis, these are chronic conditions that are things that I think of like diabetes or heart disease or arthritis. We don't really have a good way of curing them, but we have a good way of managing symptoms and managing the manifestations of these diseases. It's sort of like, dry skin or skin conditions too. You can't really cure yourself of that condition very easily. You can have ways of mitigating your symptoms and the severity of what you're experiencing. So that's really what we're dealing with here.
Okay. Now I should have asked this sooner, but why do we have sinuses, and what are they supposed to do when they're operating properly? All right. Because you talk about this network of cavities in your head. Why are they there?
Yeah. So that's an interesting question that I sometimes get from patients. There's theories as to why the sinuses are there. First is that, back to that evolutionary talk about why we have certain reactions to things and why our body is developed in a certain way. When we, tens of thousands of years ago, when we didn't have a lot of good medical care, when we didn't have doctors, one of the theories is that the sinuses developed, because it's a crumple zone, sort of like the bumper or the crumple zone in your heart, is if you get hit in the head, or you have any trauma, it doesn't go directly to your brain or some of the vital organs that are important to, you staying alive or you staying conscious. And so having a fracture in your nose or a crumple zone in your head, that's inconvenient, but it's better than having a major head trauma or a brain bleed. The other couple things are that, when the sinuses grow in and take up part of the volume of the skull, they actually lighten the skull so that it's not so heavy. So that serves advantages in terms of being able to, walk around, not get so fatigued when you're walking around and doing your daily thing. And certainly we see that in other animals like birds. They'll have skeletons that are somewhat aerated or lighter, and so they're not so dense. So that's also one of the theories behind why the sinuses have served us well in the past. The other thing is that, maybe a little less thought of, is that the sinuses also contribute to resonance when we use our voice, or also when we breathe. That helps to increase the resonance of our voice and increase the volume and make it so that, communication and speech are a little bit more effective than if we didn't have those areas of basically air volume in our skull. That
is fascinating.
Yeah.
I would never
deal with that kind of anatomic and evolutionary perspective, but from a very low, from a very high level understanding of it, that those are some of the things that we understand about them.
Yes, certainly. I understand it's a theory, but I got to tell you that none of those are what I would have expected you to say when I asked that question. I thought perhaps they were some sort of filtration system, or I don't know. But that is especially the crumple zone idea is fascinating. So very important structure. Sometimes you're going to have problems with it, but if you do, come in and see you.
Yeah. Just bring our discussion back to allergies. Although it is somewhat of a common issue, it might seem a little bit mundane from the perspective, I'm a surgeon that does specialized surgery on the sinuses, but also the skull base for neurosurgical issues. Why are we talking about allergies as this interesting thing today? But I think that, are something that affect so many people. We know that probably about 1 in 4 people
Mm.
suffer from symptoms related to allergies and what we call allergic rhinitis, which is nasal manifestation of allergies. And when I see patients like that, like I discussed before, I have my approach to medical management allergies, but there are some people who just don't get a whole lot better. They're using nasal sprays, rinses, and things, and they're doing allergen avoidance, and they just can't seem to get good control of their allergies. There are a couple things that we do for those people. One of the things that we understand can be really helpful is allergen immunotherapy. So going to your allergist, getting allergy tested, and then if you have something that you're allergic to, doing something like the allergy shots or the sublingual tablets under the tongue can be really helpful. The issue with that is that, allergen immunotherapy, although it's good and it can actually modify how your system is reacting to allergens, give you long-term benefit, is that a number of people don't respond to allergen immunotherapy. It's just not effective for them, or it's only transiently effective. And after you stop the immunotherapy, your symptoms tend to come back. The other thing about immunotherapy is that the shots or the tablets, you need to do them regularly. And if you have to go to your doctor's office to get the shots regularly over, and it usually continues over like a 3-year period, and there's a ramp up period of about 6 months, that's a lot of commitment to do that. And so a lot of people find that that might not be the best fit for them, for their lifestyle or what they're experiencing. So the other option that I actually offer patients with very severe allergies is actually procedural options, which, is getting a little bit more recognition recently. And this is a special area of expertise and research that I have, is procedural interventions to improve allergies. So we know that, when you breathe in and air, and again, like we're talking about, aeroallergens are the major thing that we're talking about here, is things inside the air, irritants inside the air that cause the allergic reaction. And when you think about it, when you breathe in, most of the time people are nasal breathing. And the first structures inside in your body that are sampling this inspired air that you're breathing in is your nose, different structures inside the nose. And so we have procedures now that we know are effective a lot for nasal breathing, but we're realizing now that these are also effective to reduce allergy symptoms, because there's something about reducing irritation and the reactivity of the nasal lining inside the nose that can have a beneficial effect on how the body responds to allergens. That is something that we're having a greater understanding of. And now we have a better understanding of, these procedures that we have for the nasal cavity and to help people breathe better actually somewhat help allergies, which is a little bit of a little more involved discussion than that we have for today.
Just briefly, what would be the procedure? Can you?
Yeah. So a lot of people come to me with nasal breathing issues that we will attribute to a deviated nasal septum, the thing that divides the left and the right nasal cavity, made of cartilage and bone, that seems to be crooked. That can cause nasal obstruction. But the lesser known problem is what we call turbinate hypertrophy. Turbinates are these normal structures in the nose that run the length of the nose and serve a normal function. When we breathe in the air, it humidifies, filters the air. But those are structures actually that are important for sampling the inspired air as well and eliciting the allergic cascade. So when we know that we reduce the size and reactivity of the turbinates through several different ways of doing that, either applying some heat energy to kind of scar up the turbinates through a radiofrequency ablation, or an actual procedure to reduce the size of them by removing some of the inner tissue inside the turbinates, and doing the septum, and possibly also reducing some of the swell areas inside other parts of the nasal cavity, we're finding that can be really helpful, not just for nasal obstruction issues that patients traditionally come to an ENT for, but also allergy symptoms like mucus production, drippiness of the nose, and sometimes itchiness of the nose and eyes as well.
Turbinates, is that what you called them?
Yeah, the turbinates.
Okay, where are those? And just like give a sense of the size.
Yeah. So you actually have 3 sets of turbinates: the superior, the middle, and the bottom, the inferior turbinates, as we call them. The inferior turbinates are the ones that play the biggest role in nasal obstruction and probably also the allergic cascade. They are probably about the size of an HB pencil, basically, or a thin pen. That's about the volume of them, and they run the length of the nose, and they're probably about 2.5 inches in length. So they run the length of the nasal cavity, and they're not really very well known structures inside the nose, but they are very important for normal things like sensing airflow, humidifying air, filtering air. But again, they are also reactive structures. So when you breathe in aeroallergens, they can swell up and react very aggressively. The other thing is that they're also gravity dependent. So when you lay down, they can also swell up in size, which is also why, as an aside, you may be experiencing fluctuating nasal congestion during the nighttime when you lay down, which is part of that, what we call the normal nasal cycle, which involves swelling of one of the turbinates and regression of the size of the other one. And then, 30, 60 minutes later, it switches back and forth. And that is also a discussion for another time. And there's some thought that it's someone on the evolutionary perspective of, that is somewhat helpful for us. But that's one of the things that I often do see in patients who come to me.
Okay, we'll do another podcast just on the turbinates. That's fascinating.
Yeah.
So you're doing research on that.
Yeah. And we could have a whole discussion on actually procedural interventions for nasal issues that overlap with allergy, but also nasal obstruction. It's a very fascinating area that not a lot of people think of, but I get a fair amount of patients that come to me that end up getting a procedure inside the nose that is relatively limited and minimally invasive, but can be super, super helpful and even life-changing for some people, both from the nasal breathing perspective and the allergy. And these are procedures that have nothing to do with sinus surgery, but are really surgery to optimize several different things inside the nose, reduce the reactivity of the nasal lining, can be really helpful long term.
Yeah, gotcha. And I imagine this is probably, outpatient, you're in and out in a day.
Yeah. A lot of the surgeries I do, are not life-threatening. They don't involve people having to stay in the hospital, are not emergent, but, are things that we do to improve people's long-term quality of life. They're minimally invasive. It typically doesn't involve a hospital stay. So people are in and out the same day. So, people find that the procedures, when they really do need them, can be really, really helpful.
Absolutely. Well, it's, one of the 1 in 4 people who suffers allergies. I can tell you that when you find something that works, it feels life-changing. Right. I mean, these are not, none of this is going to kill us, but boy, it can be unpleasant, as you say. I mean, fatigue and every other thing that goes along with it. It's a complex.
All kinds of things. Not being able to function during the day.
Yeah.
Not able to sleep well during the night.
Yeah.
These are huge things that can really, really debilitate you.
Totally. Absolutely. I mean, not being able to think clearly at work is just, that's no fun. All right, so let's make a date. Let's do another one of these, and we're gonna dig deeper on turbinates because that's fascinating. But
we could have a whole discussion on turbinates, which is kind of sounds like a silly issue because they're so small, and they seem to be so simple. But I think there's a little bit more behind the curtain.
Yeah, and there's a lot of people out there who might be interested in that kind of treatment. I mean, that's fascinating. Dr. Yong, I really appreciate your time. This has been illuminating. Let's do it again.
My pleasure. Thanks so much for having me, Anthony.